The entire population of northern Gaza is at risk of dying. These are the haunting words of Joyce Msuya, the acting Under-Secretary General for Humanitarian Affairs at the UN, regarding the dire situation in northern Gaza. For weeks now, Israeli airstrikes have relentlessly targeted civilian areas, killing over 900 people in just 3 weeks and leaving families trapped under rubble. As international focus shifts to other conflicts, the plight of Gazans remains largely ignored, with reports of severe violations of human rights and humanitarian law mounting daily. What kind of violations are civilians facing in northern Gaza? How is the Israeli government leveraging media narratives to divert attention? Will the international community finally take action against the genocide unfolding in Gaza? And what is the current status of humanitarian aid in the region amid these ongoing attacks? We'll answer all these questions here on In Depth. Incessant Israeli bombing in northern Gaza has killed over 70 people and created a situation for civilians that the UN chief called unbearable. The Guardian highlighted the current situation in deadly airstrikes, describing Israel's new assault on Jabalia, Beit Lahia and Beit Hanun as increasingly sporadic and difficult to verify. The UN estimates that the blockage of aid and food deliveries, along with targeting of civilian infrastructure, has led human rights groups to accuse Israel of seeking to forcibly displace the remaining population, which is considered a war crime under international law.
As war in northern Gaza rages, the humanitarian crisis deepens, particularly in Beit Lahia and Jabalia. For nearly 3 weeks, relentless Israeli airstrikes have devastated communities, resulting in the tragic loss of nearly 900 lives, predominantly women and children. The UN's acting humanitarian chief, Joyce Msuya, has called for an immediate cessation of hostilities, urging Israeli forces to stop what they are doing in northern Gaza, where the entire population is at risk of dying. The situation has become disastrous as the Israeli army enforces a ban on the entry of all food, water, and medicine. Furthermore, healthcare facilities are overwhelmed, with the World Health Organization warning of catastrophic conditions. Kamal Adwan Hospital, the last operational medical center in northern Gaza, is under siege, with reports of injured staff and damaged ambulances. The chief of the World Health Organization, Tedros Adhanom, has highlighted the urgent need for aid, stressing that healthcare workers are being detained amid ongoing military operations. In light of these harrowing developments, UN Secretary-General Antonio Guterres expressed deep concern over the levels of death and destruction. Meanwhile, protests have erupted in southern cities like Qnews, while residents are demanding urgent international assistance to address the escalating humanitarian crisis. The world watches on as northern Gaza cries out for help, urging for a resolution to the endless war.
Now, to discuss this further and look into the current humanitarian situation in northern Gaza, we are joined from Jerusalem by the UNICEF spokesperson, Qasem Abu Khalaf. Thank you very much for joining us. Let's start with that quote that I gave at the top of the program. The UN's top humanitarian official has warned that the entire population of northern Gaza is at risk of dying. Do you agree with that? And could you tell us more about what you think about it?
Thanks for having me. Of course, actually, I do agree. What was said based on basis of reports that are coming from the Gaza Strip, from the northern part of the Gaza Strip. Relentless bombardments, exactly as your report has said and mentioned. You mentioned Jabalia, the report mentioned Jabalia. 30, I'm looking actually at the figures as they keep coming, 30 airstrikes in just the last 2 weeks. 16 of them were only in Jabalia, and I'm talking, of course, about the northern Gaza. Hundreds were dead, were under like deceased, were killed, and of course, needless to say that the civilians are usually the ones that pay the highest price of the war. Children, especially children, they did not start this war. Of course, they cannot end it, yet they continue to pay the highest price. And if I go on and on the suffering of children, as to be honest, to a certain extent, it actually goes beyond imagination.
Let me ask you about children, with that being your area of expertise. What is the life of a child in northern Gaza like at the moment?
There is no life for a child in northern Gaza, or even in the whole Gaza Strip. Children in Gaza Strip are going through what any child in the world should not be going through, and they're going through this for more than 1 year now. If you don't fall for the bombardment, you probably fall for diseases, malnutrition. Some have lost their limbs, one or more. We're talking about no less than 19,000 that we call them the unaccompanied. They either lost both of their parents or one parent. It's continuous. I mean, the problem is that all of this is happening whilst the whole world is still watching. In vain are going all of our attempts and our calls to have actually stop. It's not actually going anywhere, to be honest. All of our briefings and calls and the Security Council and what have you, it's not at all being fruitful, if you want.
And could you outline for us the most urgent humanitarian needs and explain how this has been obstructed currently?
Look, you're talking about the people of Gaza that have been displaced multiple times. These people have run away, they fled, they left everything behind them, so they need everything basically. But I mean, it's a very, very long list, to be honest. So first, you're talking about medical supply. They lack cleaning supplies, they lack clean water, they lack food, they lack, you want that is much. No less than 15,000 people in Gaza need to be medically evacuated. No less than 2,500 of them are actually children. Some of the children have lost their limb or could have been saved, but only because of the lack of the medical supplies necessary, or medical experts and surgeons, that they had to pay this very, very high price.
And Mr. Khalaf, how do you assess the impact of the Israeli policies on the status of humanitarian aid in Gaza, particularly regarding medical supplies, as you allude to, and also access to food as well?
If you could repeat the question, I couldn't hear you well, sir.
Yeah, what I was asking was, there have been obstructions. We're hearing that there have been obstructions, and Israeli policies are impacting the access to food and medical supplies. Could you comment on that?
Yeah, well, look, what's happening in Gaza. Let me talk about it. Prior to the war, in Gaza used to go into the Gaza Strip, no less than 500 trucks of aid, but also commercial trucks. Now, before all of this destruction and before all the war and before all what we were seeing in TV reports and reading through different media outlets. Now, and since the beginning of the war, 2 weeks actually after the beginning of the war, when the Israeli authorities started allowing some aid to go into. Now, if you take all of the number of the aid trucks that went into Gaza since the 21st of October 2023, and divide that by the total number of the days of the war, you're talking about no more than probably 50 trucks on average going, in comparison to 500 per day prior to the war. And you only wish that at least, okay, well, 50, maybe 50 food, or 50 that are full of drinking water, or what have you. Well, the answer is actually, it's not like that. Sometimes you have 50 trucks going in one day. Sometimes there are 4, maybe 5 days with no trucks whatsoever. And then sometimes you have 120 or 150 trucks allowed into Gaza. Not all are loaded with food or what is the top priority. Sometimes they are loaded with pots and plates. Sometimes they are loaded with wood and coal. So it's not sustainable. It's not like it's done on ad hoc basis, not on basis of the priority list that are provided by the humanitarian organizations that are working on the ground in Gaza, which causes more suffering. Even the humanitarian response there on the ground in Gaza is not sustained in terms of, I'm talking about a meaningful humanitarian response. There are, the rules, the conditions, the foundations that should be there for a meaningful humanitarian response. None of them are in Gaza. The telecommunication network, sometimes it's available, sometimes it's not. Roads are destroyed. Fuel, of course, is lacking. There's a lot of scarcity in fuel. Enough trucks are not there in Gaza. Not everything enters in Gaza according to the list provided by the humanitarian experts, and so on and so on. And on top of all of that, the bombardment continues. People, especially in the north now, since almost a month, are asked to move towards the south, maybe the center of the Gaza Strip, to Al-Mawasi area, which is, to be honest, very sad, because Al-Mawasi area represents no more than 3% of the total space of the Gaza Strip. In normal circumstances, in Al-Mawasi area, there are around 10,000 people, 9,000 people living there. Now you're talking about 730,000 people already in Al-Mawasi, and hundreds of thousands more in north of Gaza are asked to move south, as in go to the so-called, quote-unquote, the safe areas of Al-Mawasi. So even what the civilians are being asked to do is really unfathomable. Some of them, they go, they are displaced. I have a friend that has been displaced. He told me 9 times I was displaced in northern Gaza Strip, simply because he chose not to leave his house. So that's the problem. The problem is that you either leave or you are actually at risk of being killed, which goes against the humanitarian international law, because you're supposed to be given what keeps you alive and safe, whether you choose to leave or to stay.
And what do you say to someone like your friend who's been displaced 19 times, and to people like your friend? What do you say to them to give them hope? Is there any hope?
Look, I think the Gazans have a lot of hope. You wouldn't imagine how resilient they are. But for somebody that is outside Gaza, just watching, talking to media, trying to explain, what can you say to a friend that he knows? He told me, my house is gone, but I'm there to preserve and guard the ruins of my house. I simply choose not to leave. And frankly speaking, I try to contact him almost every day. All I want him to do is to just tell me that he's still alive. And sometimes I succeed, sometimes he is not responsive. So there goes of course, the stress, and whether, I don't know what happened to my colleague, to my friend, or what didn't happen. To be honest, scenarios that you wouldn't really would like to think of. But this is how it is in Gaza, and he's only one person. So imagine these thousands of families and children and so on. And speaking of children, speaking of the situation in Gaza, their health, for instance, namely, we had to delay and postpone the third phase of round 2 of the polio campaign. We are supposed to be going to the north, Gaza City and northern Gaza, to administer the vaccine against polio for 119,000 children. Okay, but because of the ongoing attacks, because of the ongoing bombardment, we're not there yet. And it was delayed and delayed and delayed. That was a decision made by UNICEF, by UNRWA, by WHO, by the Ministry of Health.
And when it comes to the polio vaccine, and what happens if they don't get this second dose?
Can you repeat the question?
When it comes to the
Colleagues in
polio,
the studio, I can hear the colleagues in the studio as well. So if you could just repeat the question.
apologies for that. When it comes to the polio vaccine, what happens if they don't get that second dose, the children?
Well, the thing is that we go back to ground zero. The whole aim behind the campaign for polio vaccine was to save the children in Gaza from being subject to this very dangerous disease. They will be paralyzed, and the targeted number is 590,000 children in Gaza. We did that in the first round, and we managed to cover more than 90% of them, which is a criteria for success, an indicator for success. But then when we started after around 6 weeks, the second round, which is important, just equally important as the first round, we started with the middle and we moved to the south. This is how it was arranged. And then we're supposed to be moving to the north. Now we got the coverage of around 76%. If God forbid, we do not make it on time up north, then this will impact, of course, the attempts to boost the immunity of the children. So interrupted rounds more than 6 weeks will definitely have a serious impact. It will jeopardize actually all of the efforts to stop the spread out of the disease or the transmission of the poliovirus disease. So more children will be falling into the circle of paralysis, God forbid.
Well, Kazem Abu Khalaf, stay with us. We're going to come back to you, but thank you very much so far. We're going to be joined now from Ramallah by Ahmed Shadid, who is an Israeli affairs expert. Thank you very much for joining us, Mr. Shadid. Now, there are indications that Israeli actions could be classified as genocide. What do you make of those claims, and how does that sit with international law?
Okay.
I'll give you the question again. I don't think you quite caught it. There are indications and claims that Israeli actions could be classified as genocide. What do you make of those claims?
First, welcome to you and to your audience. If we exclude the United States of America, and here we're talking about with the logic of the neutral analysis, there are cases in the International Court of Justice and the International Criminal Court. There are witnesses on operations recorded on cameras, like shooting the prisoners and exploding whole towns while the residents are inside without any claim or without any justification. These actions would have not been classified as war crimes. I don't know what would be classified, because according to the international law or the UN Charter, what else can be described as a genocide? So what happens in Gaza Strip is real. It's a genocide. It's ethnic cleansing operations at all levels, either by displacement of the residents or by executing people. We're talking about almost 150,000 victims. Most of them are women and children. We cannot imagine that there would be any victims from innocent civilians in any military confrontation, but having a number of 90% of victims are civilians, according to the statistics. This means that Israel is deliberately committing these massacres, and I do not think there is a law or a description that can be granted to this case except for the genocide.
And do you believe that the Israeli government is exploiting the media to try and shape international perceptions of the situation in Gaza?
We've always been discussing this question and this part based on our analysis to Netanyahu character and his government, either his Minister of Finance or his Minister of National Security or his Minister Gadron Sa'a. So this government is based on some methodology, mess from the Holy Book. Most of them are based on blood, sword, and codes. So this is what Netanyahu says. It's a government tries to create a reality in Gaza by evacuating the residents, by killing and destruction and genocide and massacres that are committed day and night, using all the types of weapons, including starvation as a weapon. And this alone can be taken as a case study. And according to the Israeli data, we can prove that Israel is committing an ethnic cleansing operation, a genocide, represented in the form of siege at the economic and humanitarian levels in Gaza Strip. Yes, Netanyahu's government tries to create a reality here. A few days ago, we watched that more than 20 members in the Knesset, most of them are ministers in Netanyahu's government, went to Gaza Strip in order to establish a settlement in this region. All of these indicators refer to a single thing, which is Netanyahu and his government to try to replace the place of the indigenous people by settlers, either by killing, burning, or destruction, with the same goal, which is the displacement of the indigenous Palestinian people to be replaced by settlers. And this is clear in the program of Netanyahu and his ministers. It's not only an analysis, it's a reality.
Well, the UN has called for a ceasefire, Mr. Shadid, and also accountability for violations of international law. What do you think it would take for the international community to take some kind of meaningful action against Israel and the reported violations in Gaza?
At the beginning, I said that the United States of America is the pivotal point in your amazing question that you posed, which is that the United Nations called a lot. We can describe them as resolutions because the United Nations Security Council didn't issue any resolution for a ceasefire. That's why there is the international community didn't do their duty, and the United States is covering the Israeli occupation and any pursuits by the United Nations in general or the Security Council, even in relation to the access to humanitarian aid. If they are not covered and protected by the United States stance, they will be only a fairy tale. But making the Security Council responsible for what's happening in the region is not correct. Of course, we can blame the Security Council, but the Security Council is limited to the United States. I don't believe that the Chinese representative would, or the Russian, or even the British or the French representatives would object to the ceasefire. The main problem is the United States, and the best expression describing the elite or the leaders of the United States was said by Biden himself in last March when he asked Netanyahu that he know if photos should be public on the massacres in Rafah before invading Rafah. So his only concern is the media, because I do not think he's not really interested.
Okay, well, thank you very much, Ahmed Shadid. I just want to. We're running out of time, so I just want to bring Qasem Abu Khalaf back in, our UNICEF spokesperson. What do you foresee in the coming days and weeks for the people in northern Gaza? Are we going to see a change?
I truly wish that there will be a change for the people of Gaza. Only the ones in the north, although the ones in the north, the ones like I said, need to go through the figures from the colleague. But if you have time, I just want to share. Out of 2,000, I mean, between January and May in this year, the average of evacuated children was 296 per month. Now, since the 7th of May, it dropped to 22 per month medically evacuated. That's fewer than one child. That's fewer than one child per day. So this means that if we have 2,500 children, it means that it would, on this average, on this pace, it will take them 7 years to be evacuated from Gaza. So what's happening in Gaza, the children are actually dying or waiting to die.
Okay. Well, thank you very much, both of you gentlemen, for joining us on the program. Kazem Abu Khalaf from Jerusalem and Ahmed Shadid from Ramallah. Thank you very much, both of you. And that brings us to the end of this episode of In Depth. We hope you found it very interesting and fulfilling. Thanks for watching.